Hi guys, how are you? This is Dr. Aya Al-Khayat. I'm final year medical resident in Hamad Medical Corporation in Doha, Qatar. We are in Lusail, beautiful Lusail. Look at the view, it's so pretty here. So I was born in Iraq and I'm Iraqi and I grew up in Abu Dhabi. I have been living there since I was like 2 years old. I'm here with Hassa, who is behind the camera. She's waving. We decided to make this interview because I know you guys have a lot of questions. We have like a 2-page list of questions and we will post this interview inshallah. And if you guys have any further questions, we are more than happy to answer them later on. When I was 17 years old, I graduated high school and that's when I got into medical school. I got into RCSI Bahrain, which is the Irish school, the Royal College of Surgeons in Bahrain. Why did I choose medicine is actually because my father is also an internal medicine consultant in Abu Dhabi, and he was one of the reasons that I picked medicine. To be honest, there wasn't any specific moment that I can recall. I was very young. And I just remember like seeing my dad and being with my dad in hospital because I would go with him sometimes. And that's what pushed me or like made me choose medicine. And that's actually the reason that me, my sister, my brother all chose medicine. I don't think I had any extracurricular activities when I was in high school. I was very, very academic, but I did get very good grades. The school, the high school that I went to was very, very strong. I went to Shwayfat, and it was basically just whole academics. You know, if you have been to Shwayfat, you know how many exams you have to do, or if you know of Shwayfat. And I think that made me really focus on my grades. And I think that's what really got me into medical school. And also, I think the college I went to, they liked that I had someone who is from medicine, which is my dad, we had like a doctor in the family, because that showed that I knew of medicine. If you don't have the science subject, like for example, in my medical school in RCSI Bahrain, they required you to have 3 science subjects: chemistry, biology, and physics. I think physics or math, if I'm not mistaken. So if you don't have one of them, they actually allow you to do, instead of the 6-year program, they allow you to do a 7-year program for you to get that subject. And there's also a 5-year program, but usually for a 5-year program is for graduates who already did college. For example, if there's a student that graduated from Canada and then they had a biology degree, then they don't need to go and do a 6-year program. They can just go into the 5-year program at RCSI. But if you didn't have that degree and you just had the 3 subjects, for example, of like physics, biology, or chemistry, then you would have to go into the 6-year program. But there are some exceptions. If your grades are exceptionally good, you can get into the 5-year program. So if you didn't have the subject, then me personally, from my medical school, they did allow you to do the 7-year program to make up for that subject. And the other thing is for the grades. If your grades are not good and you still want to pursue medicine, to be honest, a lot, or I think if not all of the medical schools, they really need you to have good grades, especially in the science subject. Because, you know, this is just the start. You need to have good grades to get into medical school, because medical school is not easy. It's going to have a lot of exams. You're going to be studying a lot. So my advice is to retake those tests if you can, and if you cannot retake them for any reason, then make up for your grades with extracurricular activities that shows that you are very interested in medicine, like have volunteering, have research, have work with doctors, get recommendation letters from doctors. But the better thing to do is to really retake the exams and get the required grade to get into medical school. I wouldn't say I didn't expect to learn it. I think I was forced to learn it. So it's time management and being disciplined. In medical school and during residency, you have very limited time. You have limited time for yourself, for your friends, for your family, because a lot of the time you're either, if you're in residency, you're going to be working, and if you're in medical school, you're going to be studying. Unfortunately, it's doable if you can manage your time. I think I was forced to manage my time because I wanted to have time for myself. I wanted to go out with my friends. I feel like it helped me, have a better management of my time and of my day. And also another thing is that it really taught me discipline, because in medical school, you have a lot of things going on. You'll have to wake up early, go to lectures, and then go to hospital if you have the rotation there. And then you have to come home and you'll have to study. So you have to be disciplined in the way you show up. And you really can't be late, or you can't skip some days and show up some days, because there's an expectation from the doctors around you, especially when everyone around you is very disciplined. Everyone who works in hospital is really disciplined because patients depend on them. Yes, I do think RCSI Bahrain gave me a good a foundation. I went into the 6-year program with RCSI Bahrain, and I graduated from them in 2020. And then I did my internship in King Hamad University Hospital in Bahrain. So the reason I say it gave me a good foundation is because they taught us how to do physical examinations and do OSCEs literally from like the first year. So you were put in situations of OSCE. OSCE, if you're in medicine, you would know what an OSCE is. An OSCE is basically when you have real patients or simulated patients sit in a room with an examiner, and you'll be called in to examine this patient, and you will be graded on it. And so they would put us in situations like that literally from the first year. And I think that helped me when I became a doctor, because it just felt like something that was like a switch. It was very easy for me. Another thing, they really RCSI really helped with how the exams were done, because I felt like when I was studying for the RCSI exams and the way they taught things, it was like, now when I do exams, it just feels so similar to the stuff that I studied in RCSI Bahrain. And the reason I say these things is because I would compare myself to my colleagues who didn't go to RCSI Bahrain, and I would notice that they would have weaknesses in that. And alhamdulillah, for me, that was that I think I learned that from RCSI Bahrain. But I will say something. I just wish that I had more time in clinical settings, because I feel like that's something I struggled with a little bit when I started my residency. And but at the same time, I graduated, I was the COVID group. So I feel like maybe that was the reason, because there was COVID for 2 years, and by the time I graduated. But I do wish I had more time in hospitals and in clinical settings. I was just telling Hassa, this answer is gonna have a long answer. So to be honest, there's 2 parts of me. It's like a 50-50. And I love medicine in theory. I love studying it. I love reading. I just think, and I love teaching it too. But I feel in practice, it's really, really draining. During residency, during the on-calls, we can do up to 28 hours to 30 hours when you're on call and post call. And it's really, really tiring. And I just feel like, if maybe that wasn't in the picture and it was just theoretical, then it would be, then my answer would be yes, 100%. I would still choose medicine if in practice it was a little bit less hectic. I don't think it's something that I was stressing about. I don't think there's really anything like that. But if there is one thing that popped in my head, is me trying to fit in during high school and during medical school. I think if you're just not fitting in with the people around you, then either try to find people who are more like you or just stand out. Because I feel, when you're not meant to be with that certain group of people, then you're just meant to do something different. And I think that's the one thing, looking back, or if I would change in high school and medical school, is I just would not try to fit in with the wrong group of people, and I would just try to find or know myself better. Be always hardworking, be disciplined, know how to manage your time. If you get these three things, then you can you can manage medical school and residency, and you can manage anything in life, to be honest. Just really be disciplined, be on time, get your work done. Try not to procrastinate. I know procrastination is sometimes it's just the easy thing to do, but really try not to procrastinate. If you have a subject or something that you need to study for, just study it, read it that day. And another thing, always review, keep reviewing. In medical school, it's massive amounts of information. In residency, the studying is a little bit different. I can talk about that later. But in medical school, your only job is to literally get all of this massive information and put it in your head, and then write the exams, dump it into the exam. And it's a lot of information. So you really need to find a good study method. Some people like videos, some people like reading, some people like audio, some people like lectures. Find out whatever is good for you and master it. There's a lot of resources online that can help you. Attend all of your lectures. Be there on time, like I said, and just study hard and you will be more than fine. Communication. You're going to be talking a lot of communication with the family, with the patients, with other doctors, with nurses, with the physiotherapists. You're going to be talking a lot. So make sure that, you have good communication skills. And it's something that they will teach you in medical school. But I feel like this skill, you have to also practice it outside of medical school. You have to have good communication skills, because it will make your life so much easier when you're talking to other people, to other residents, to other doctors during your training. That's one of my favorite questions, actually, because I remember very clearly when I thought of applying to Hamad and to apply to come to Qatar. And I still remember it very clearly, because I think the second I decided that I wanted to come here, it was like my path was just, it was like carved by God to come here. Allah made it so much easier for me. So the reason I picked internal medicine is first because of my father. And the second thing is that's really the only subject I liked during medical school. I loved the internal medicine rotations. I loved the internal medicine patients. I loved that internal medicine, you can subspecialize further into it. And I just liked it, and I got really good grades at it. And the other thing is why Hamad. So I know a lot of you already know Hamad Medical Corporation has the best, or one of the best, training programs in the Gulf. And I had some friends from Qatar who came to do medical school in Bahrain as well. I kind of asked them about the program. Once I started knowing a little bit more about the program, I decided, I want to apply and come here because the program is so good. I think the most important thing is your grade. I think, the grades matter. In medicine, the grades do matter. So you have to have a good grade, whether you're doing your step 2 or you're doing your IFOM or the Canadian exam. You have to have a good grade. And other than the grade is having research, or having like a quality project in the field that you want to apply in. For example, if you're applying for internal medicine and you have a specialist interest in like cardiology, for example, then have some case reports, have some research in the cardiology department or in the internal medicine department. It will look really good if you have research and quality projects and volunteering, because it will show that you are interested in enhancing the program. And for specifically Hamad, if you can come here and do your internship or do attachments, clinical attachments, so that the doctors and the program director can know about you. So when you're applying, you're not someone that they don't know. That will also really help. Another thing is like having extracurricular activities. If you're interested in, for example, sports, or like if you're interested in other things outside the hospital, then it's good to also mention that, because it will look like your whole life is not just medicine. You have like something else going on. I think for the US medical school, to be honest, I don't think it's easy to get in unless you're a US or a Canadian citizen. I think you will have to do the undergraduate degree, which is usually in medicine, something related to medicine, like chemistry or biology or physics, and then you'll be applying to the medical school in the States. To get into medical school in the States, you will have to do an exam called the MCAT. And the MCAT is, it's not an easy exam, and it's also like a very long exam. But to be honest, I don't know much details because I didn't go to medical school in the States. But for the UK, I think doing medical school in the UK is, I think you can apply and get it. And it's also like a 6-year program. I think for regarding the licensing, they mean residencies, huh? So regarding the residency in the States, so the American board is really, I would say, invaluable. It's really, really good. If you can go to the States to do your residency, then please go ahead. Write your steps, which are your exams needed to get into residency in the States. Write your step 1, write your step 2, and go into residency in the States. The residency program, for example, for internal medicine is only 3 years, and then you'll be an attending or a consultant, which is really, really good. Once you get the American board, then you can really practice anywhere that you want. I would suggest, like, if you're planning, if you're planning to do residency somewhere, then try to do your steps and go to the States. Now, for the UK, my sister is actually in the UK. She's in Cambridge. In the UK, the medicine system is really long. So they have to do, after you graduate from medical school, you have to do 1 year of internship. In the UK, it's 2 years of internship. And then after the 2 years of internship, you will be applying into your core training, core training is basically like residency. They just have different names. And then the core training, for example, let's say you pick internal medicine, and I think it's like 4 years or 5 years. And then after that, you go into further subspecialization, endocrine or cardiology, whatever you want. I don't know much details about the UK because I don't practice there, but I do know that the process is a little bit long. But if you're planning to go to the UK, it's also a very good option. I am not 100% sure whether if you're a non-Arabic speaker, whether they will not count your application. I'm not 100% sure, but you will need Arabic because all the patients, I would say, not all, but most of them speak Arabic because it's an Arabic country. I'm not 100% sure whether they will count your application or they reject your application based on the Arabic part. But I do recommend that you try, if you're planning to come here, do try and learn Arabic or take a course in Arabic because it will help you tremendously with the translation. Obviously, it depends from rotation to rotation. On harder rotations, when I wouldn't really have time, I would just try to rest after work. But generally speaking, work starts at 7, ends at 3. At 7 a.m., there'll be like a morning lecture. The morning lecture is usually like a case presentation done by the consultant and presented by one of the residents that's with him in the team. And it will be like an interesting case. And the residents will all be sitting in the lecture hall. And it's a kind of like a discussion. It's usually very interesting cases. That's from 7 to 8. And then if you're rotating, or if I'm rotating in medical teams, then at 8 a.m. we would start the rounds on the patients with the consultant and the juniors, and there will be also pharmacist with us and a case manager. And then we would rotate on the patients. And then once we're done rotating on the patients, we usually finish 10, 11 a.m., sometimes later if there's a lot of patients admitted. After we're done rounding, then we would start working, doing the work, putting the medications, doing the consults, talking to the families, and doing the discharges, preparing the outpatient medications. After we're done with all of that, sometimes some emergencies happen here and there. If the patient gets sick, then we'll have to go see them again. So it just depends, but usually it's like that. And then there's endorsement from 2:30 until 3 p.m. about the patients, especially if there's a sick patient, then you have to endorse him. And then you get to go home at 3 p.m. Obviously sometimes you don't get to go home at 3 because there's a lot of work and you'll have to stay until like 4:30 to finish your work. But if I'm done on time, I try to go to the gym after work. And then after the gym, I will come home, make some food, rest, and that's basically it. That's like my entire day. I'm starting my fellowship soon. I'm starting bariatric/obesity medicine. I'm starting on the 20th of October, inshallah. And I'm really excited because I am very into fitness and into health. And bariatric medicine is the perfect specialty in that part, because obesity, when you're in medicine or you're rotating and you're doing, you see the patients, you'll notice a lot of these problems. The main core issue is obesity. And that's why I picked it. And I wanted something that's more outpatient with less like inpatient setting. And it felt like it was the perfect mix for me. Regarding the medicine part, I want to have my clinic and I want to have my patients and my own patients. That's like for the medicine part. And for the other part, I want to be more on social media. I want to be more out there. And I want to be more of like a content creator. Another like dream of mine is to actually work in universities and teach students, because I really, really love that. And so yeah, inshallah. One lesson is to always, always, always listen to yourself. People will always give you ideas. They will always give you thoughts. They will always tell you, but you always know the answer, and you always have to listen to yourself. Because if you don't listen to yourself and you don't do what your heart desires, first, you will never live in peace. And the second, the voice inside of you will never disappear. It will just be stronger and stronger. And at the end, you're going to do it. You're going to do whatever your voice is telling you, but just maybe at a later time. So if you have something inside of you that's telling you to pursue a certain job, or go somewhere, or travel somewhere, or move to a certain country, or be friends with that person, then you should always listen to that voice, because it's guiding you somewhere, because that's the voice of your soul. And you always know best. Even if you take advice from other people, they will never know you like you do. You have to understand that medicine is a lifelong journey, and it's going to be really draining. It's going to be really tiring. There's going to be a lot of moments where you're going to feel like this is too much for me. I can't handle it. And actually, I was just telling Hassa, throughout medicine, you always have to keep a positive outlook on life. Always try to see the cup half full, because the second you start looking at it negatively, it will really start affecting you. And you have to make sure that you really want it. Not your parents, not your siblings, not your friends, not your family, because you're going to be putting a lot. And for you to put a lot into something, you have to make sure that, you like it, or you don't have to love it, but you have to like it enough for you to push through. And even if you do it and you feel like, okay, this is not for me, I can't do it, it's also okay to leave. It's not like, oh, you picked medicine and khalas, your life, you can't do anything else. No, you can still leave. And if you still choose to do medicine, it doesn't mean that you have to do residency. It doesn't mean that you have to be in hospitals. You can do so many things. Medicine is so broad, and there's so much that you can do with it. That's what I would tell the students. Just push through and have a positive impact. And I think, anything in life always gets better. So if you're going through hard days in medical school or residency, and it's something that you really want, then it always gets better. And yeah, thank you guys for watching. I hope this interview will help you, and I hope that all your dreams come true. And if you guys have any further questions, you can message Hassa or you can message me. We'll be posting our accounts on TikTok and Instagram, both of us. Bye, you guys.